Welcome to our Mary Greeley Primetime Live presentation, Resistance Exercise for Mental Health. I'm Vicki Newell, and I manage the Primetime Live program here at Mary Greeley. As you came in, you may have met Danielle. Danielle Linder, she is the assistant in our department that works very close with me. You might talk to her if you call on the phone. She's newer with our department since May, so I wanted to make sure I introduced her. She's right up there at the top with the white jean jacket on, so welcome, Danielle. So this is our first in-person education program since February 27th of 2020. Yay! And that program was How to Stay Safe Online. And we didn't realize at the time how good a thing it was because we went to everything online. So glad to be here almost exactly 2.5 years later. So it's so nice to be back in person and to also be able to offer the virtual option at the same time. Now, this is the first time we have combined the two, virtual in person. It's also been 2.5 years since we've done a program. So we have done everything possible to make this a good experience, but if we have some glitches along the way, please be patient with us. We have Tim, our AV expert, in the back. He'll help us out. Jacob's an experienced presenter here, so I'm sure there'll be no problems there. We do ask in here present, if you wear your mask, if you would like to eat or drink something, you are welcome to take it off, do that, but then please put it back on. I will put mine back on, and we will allow our presenter to take his off so everybody can understand him better. Our presenter today is Dr. Jacob Meyer. Dr. Meyer is an assistant professor in the Department of Kinesiology and the director of the Wellbeing and Exercise Laboratory at Iowa State. He hails from Madison, Wisconsin, and his academic path began at St. Olaf College before he completed graduate school and a postdoctoral fellowship at the University of Wisconsin-Madison in kinesiology and the Department of Family Medicine and Community Health. Dr. Meyer then came to Iowa State University in 2017. His research focuses on the association between mental health and physical activity, exercise, and sedentary behavior using both epidemiological and psychobiological approaches. His current work examines how exercise can be used in the treatment of depression and in the behavioral and psychological effects of the pandemic. Please welcome Dr. Meyer.
Thank you, Vicki, for that. And thanks to all of you guys for being here and here. Online. It's great to be able to talk to people in person. So we'll talk a little bit about some of the research work that I've been thinking about a lot lately, but specifically trying to apply it to thinking about older adulthood and how some of the things that we're learning in general might be specifically important for people at different phases of their life. So that's the goal. If there's anything that doesn't make sense, you're welcome to, I know we'll hold questions to the end, but if I'm saying words that don't make any sense, feel free to flag me down and say, can you repeat that? Or, explain it like you're talking to your 5-year-old. I'm happy to do so. So what we're going to talk about today is, in particular, we're going to think about depression as the area of mental health that I think about the most. And then we're also going to think about cerebrovascular function. So cerebrovascular is a big word just to say brain blood flow. So when we're thinking about cerebrovascular function, we're thinking about how the body sends blood to the brain and sort of determines where it goes and how effectively it can deal with outside factors that might influence that. But throughout our whole talk today, I want us to think about my friend Gustav Fechner. He's not like a personal friend. I didn't know him. But he's going to be useful for us to think about as we kind of work through the stuff today. So he was a psychophysicist, which means that he thought about the way that physical stimuli relate to psychological factors. So one of the easiest things for us to think about in psychophysics was as they were trying to determine the 2-point discrimination threshold. So some of you might have heard of this. This is when you have two different points that you place on your body, and you try to figure out if you can feel that there are two distinct points or if it feels like there's just one. And so you vary the distance between the two, and then you can figure out, like, can I tell that that's one or two? And if you try this, you'll realize that at different places in your body, that threshold is different. So in our lower back, we might not even be able to tell something that's this far apart is two different points touching us. We might think of it as just one, because the density of the receptors that sense that kind of pressure is really low, so we don't see that. This is the sort of stuff that psychophysicists think about, is when we have some physical stimulus, how do we interpret that or understand that? Gustav, while not just thinking about things like 2-point thresholds, thought about what happens when I put my body under a stress that's related to my capacity to contract my muscles. So what he did at age 56 was take 2 9-pound dumbbells and lift them straight over his head. And he did it as many times as he could. And then when he couldn't do it anymore, he stopped. And then he wrote down, like the good scientist that he was, how many times he did it. And then he did the same thing every day for 2 months to see if he was exposing himself to the same stimulus, would his body adapt in any way? And these are his results. Across the bottom, you see each training day, and on the y-axis, you see the number of repetitions that he was able to lift. So on day 1, he lifted over his head 104 times, and then on day 55, he lifted over his head 692 times. So what we see from here is that repeated strength training is powerful. We also can see sort of his shape of strength improvement, right? We can see that at the beginning, while he did a lot better in the next couple of days, he sort of stayed at about 100 for a little while before it started to keep creeping up, and then it sort of took off after, a month and a half. And we can sort of see this sort of curve being that if you keep doing something and keep at it, you will see differences or gains that you might not see from a day-to-day perspective. This was cool. This gives us sort of the beginning stuff that, we know that if someone keeps on doing the same thing over and over again, their body's going to adapt. This was showing how that might happen with resistance training. If you keep on exposing yourself to a stimulus, what happens? You get stronger. But for me, the other question is, do you feel any differently? If you keep on doing something like aerobic exercise, we know that people start to feel better in a number of different ways, but they feel less depressed after they've continued to be aerobically active. My question is sort of, how does this relate to things like depression from a resistance training perspective? And then also, this is one of the pictures that I'll use for brain blood flow. So does continually exposing yourself to resistance training change the body's ability to move blood flow around in the brain? So why do we think a lot? Why am I going to think about resistance exercise? Well, I think one thing in particular, and especially for older adults, resistance exercise is something that doesn't happen super often. We know that roughly 20 to 25% of adults say they meet both the aerobic guidelines for physical activity. That means getting 150 minutes a week of moderate to vigorous physical activity. That's that MVPA. And 2 days a week of resistance training or muscle strengthening exercise. And the reason why this number isn't higher is because very few people meet the resistance training guidelines, whereas many people meet those aerobic guidelines. That can be accomplished through going for a walk or walking to an appointment or walking around your block. Those are things that happen much more frequently in our daily lives, whereas resistance training typically has to be something that you seek out and is above and beyond what happens normally. And so we know that if we were able to increase the resistance training number, these total numbers of being able to meet both would go up a lot. The other thing I want to point out here is that younger adults meet these at a much higher rate than older adults do. And as you see across the different age groups, the green bar is the average for each age group. And 18 and over, the average is about 23%. But that's mostly driven by those young adults, 18 to 24, 1 in 3 meeting both guidelines, whereas by the time you get to 75, only 1 in 10 people meet both guidelines. So this is an area where we might be able to increase the number of people who do resistance training and actually have some relatively important effects, or at least we'll see what that would be from a depression and other mental health standpoint. So resistance training, we can change our strength, and it looks like a lot of the US could maybe use a little bit more. So today we're going to think about depression. I just want to set the stage there. We're going to think about depression, what it is, how we look at it, what we know about resistance training with depression. Then I'll sprinkle in a little bit of the brain blood flow piece, though we don't have too much to go on there. But then I want to really make sure that we end with thinking about specific recommendations. So I convinced you. You want to do some more muscle strengthening exercise. What does that look like? How would you go about doing that? So making sure that we end with something practical. So depression is the clinical condition that my lab looks at the most. And from a clinical standpoint, this is defined as having either persistent sadness or a lack of interest and pleasure and enjoyment in previously enjoyed activities. So if someone has one of those two things that's been going on consistently, persistently for at least 2 weeks, and has a number of other symptoms that go with it, like tiredness, lack of concentration or poor ability to concentrate, insomnia, etc. This constellation of symptoms often influences somebody in a major way. So it influences their personal life, their social life, maybe their work life. If it's been going on for at least 2 weeks, then this would meet criteria for an episode of depression. Now, those episodes don't have to end at 2 weeks. They often last months or even years, potentially, for people. And this is really quite common. About 1 in 5 people have some mental health condition at any point in time in the United States. Depression is, along with anxiety, are the two most common ones that we end up seeing. So this is something that is present all too often, and something that theoretically, if we were able to either prevent or help treat, that would have big effects, as you can see, on people's functioning and work, personal, social, and other aspects. So big quality of life effects. Why are we thinking about depression now? Well, all of you guys have been around for COVID. And here's some data that we see on the frequency or prevalence of depression in relation to the pandemic. So this is the number of people who fit into each of the categories of no depression, mild, moderate to severe, or severe depression. And the dark bars are before COVID using a nationally representative data set. And then the lighter bars are during COVID, so in 2020. And what we see is that many fewer people ended up in that none category, and each of the other categories had more people in it. And not a small amount more. We're dropping from about 70 to 75% of people not having any symptoms of depression to only about 50%. So every other person has had at least some level. And so we see roughly a quarter to a third of people would have met criteria for clinical depression when this was taken in 2020. One of the strongest predictors for someone developing a new case of depression is whether or not they've ever had an episode in the past. So this means now we've gotten a whole bunch more people who are now not only going through this now, but also going to be at really increased risk of having depression again in the future, or an episode again in the future. So this is one of those areas where it becomes really clear that the more we can do to figure out how to help people who have depression or anxiety, even at subclinical levels, that's going to be really important for sort of our functioning going forward. How does this relate to older adulthood? Well, it turns out that most people who are diagnosed with depression are diagnosed sometime in their sort of late adolescence to early adulthood. So sort of 15 to 30 is when most cases are first diagnosed. However, cases continue to be diagnosed all throughout the lifespan. And in particular, there are people who often get diagnosed with depression after age 60. It's sort of termed late life depression when it first shows up then. And there might be some additional or different risk factors for people who develop it later on in life. Some of the risk factors that we see here are sort of standard ones you might think about: genetic risk factors, stressful life events like adverse childhood experiences, parents going through a divorce, or trauma as a child. But as you get going further and you see those ones that accumulate later on in life, you'll see cardiovascular disease, which is relevant to the stuff that we're thinking about with the brain blood flow. Stressful life events, activity curtailment being just a long word to say that people are less active than they used to be. So that could certainly be affected by exercise. And then if you look on the bottom, you look at protective factors. So these things help to prevent someone from becoming depressed. And we see, especially the older adulthood ones, engagement, sense of mastery, emotion regulation, social networks, meaning in life. And if you think about it, if we were to think about exercise as an intervention, could we increase someone's exercise behavior? How many of these either risk or protective factors would that influence? Well, there's certainly a couple we could see. Activity curtailment, obviously, would be reversing that one. But on the protective side, people who are more active are more engaged in their communities. Often those people are also exercising in a communal setting. Maybe you're playing tennis with somebody else, so you're having more engagement with other people. A sense of mastery, you're developing some feeling of ability in whatever it is you're doing. We know that people who are more active are better able to regulate their emotions. Social network, especially if people are doing things in groups. So we can see here that exercise patterns or behaviors could really be important, especially for some of the older adulthood stuff. Talk over here.
Stay a little closer to
Yeah.
the microphone. Thank you.
You can. I'll do my best to do it. So the intent here is for us to see that depression can happen anywhere across the lifespan, and in particular in older adulthood, exercise interventions might be more powerful than at other times. So what do we know about resistance exercise training, or that's going to be abbreviated RET, how that can influence depression? This is a quote that you might have seen before. It's a quote for a motto for lots of things, but means a healthy mind in a healthy body. So even from long, long ago, it became very clear that if we can improve someone's overall physical health, that has corresponding effects on someone's mental health. And we're going to think about this in two different ways. We're going to think about the acute effects of exercise. Then on the reverse side of the coin, we're going to think about the chronic effects of exercise. And I'll explain what those mean in the next couple of slides. So what we think about is if someone has a mental health concern, we're going to use depression here as the example, but you could put anything up here. Over time, although there will be some fluctuations that are natural, that's likely to continue unless we have some intervention or something that changes it. When we think about the acute effects of exercise, we think about what happens when somebody exercises once, during the time that they're exercising, and then for a period of time right afterwards. How does that person's, in this case, depressed mood change? And what we see consistently is that when someone engages in resistance exercise or aerobic exercise, their depressed mood state decreases. So it sort of improves. They feel less depressed than they did previously. And over time, that'll slowly return maybe to baseline or maybe not all the way back up to baseline. But what's interesting about this is that we can think about, are there some different stimuli or patterns or ways that we can design the resistance exercise itself to maximize how far down that depressed mood goes or how long it lasts for? Either one of those would be helpful, right? If we could get it so that if you exercise once, you didn't have to exercise again for a month, well, that'd be pretty cool. I cannot promise anything close to that, but thinking about how we might be able to change what it is that we do to improve those two components would be useful. And we see, I'll go through the data in a few slides. So that's when we think about the acute effects. If we think about chronic effects, what we're thinking about is what happens if somebody continually engages in resistance exercise training. So they exercise today, they exercise on Friday, they exercise again next week Monday, next week Friday, over time. And what we end up seeing is that sort of the baseline level of depressed mood, anxiety, stress symptoms decreases over time. If you think back to Gustav, you remember he slowly increased his strength over time? This is sort of the reverse of that. So instead of increasing depression over time, depression sort of decreases somewhat slowly over time. And we can think of these as maybe being related to each other. Maybe the stronger Gustav's getting, the less depressed he is feeling. These two could be involved. So those are the two pieces that we see. Well, that we look at. What do the data tell us about if resistance training can affect depression in the short term and in the long term? So here what we see is a group of 24 women who were all in a depressive episode, so had clinical depression at the time, and they engaged in 4 different sessions. They came in to our lab for 30 minutes, 4 different times, and one time they rested quietly. So they just sat on the bike, hooked up to all the tubes you hook someone up to for exercise, but they didn't exercise for 30 minutes. And then 3 other times they came in and they actually exercised. So they either exercised at a light intensity, a moderate intensity, or a hard intensity for that 30-minute session. And what we looked at is how did they feel afterwards. And although we saw that if you just got a chance to come in and hang out with people and not do anything for 30 minutes, your depressed mood state came down some. We saw that when people exercised, it came down to a larger degree, but that it didn't matter how hard people were exercising. You see that all of the exercise points end up at the same spot, sort of at 30 minutes. They're all kind of together. So light intensity exercise was as helpful for improving depressed mood as moderate intensity exercise or high intensity exercise. From a translational perspective, or like, what do we do with this? That's important because it means you don't necessarily have to go to the gym and come out sweating this close to, death to be able to get a benefit, especially when we're thinking about something like mental health. We have a pretty good handle on how important it is to exercise at a high intensity for cardiovascular health, for fitness. But if the thing that we're trying to get people to improve is the way that they feel, those ideas we have about how hard somebody has to exercise kind of change. And it turns out that the intensity is not that important. It's the doing it that becomes more important. Not that becomes any easier, but it's useful to think about what could all give us the same benefit. Interestingly here, this is just aerobic exercise data. So this is people biking. This isn't resistance exercise training. And we don't actually have resistance exercise training data for looking at things like the intensity or the number of sets or the number of repetitions that somebody might be doing for an outcome like depression. So we're kind of trying to take what we know about aerobic exercise and plug that into resistance training because that's the best information we have. So this looks at sort of how big of a drop do we get? And the answer for how big of a drop do we get is similar across all the types of exercise we used. The second question is, how long does it last? And here is another study that we looked at with biking again, 30 adults with depression. And they either sat quietly on the bike or they biked for 30 minutes. And then we had them report how they were feeling as well as a bunch of other stuff before the exercise, halfway through the exercise, post or right at the end of the exercise, and then 25, 50, and 75 minutes later. And what we saw here is that anhedonia, which is one of those 2 primary symptoms of depression. So this is the one that looks at, are you feeling any pleasure or are you enjoying previously enjoyed activities? Anhedonia improved up to 75 minutes later. And you'll see that even at 75 minutes, the exercise session was still above the quiet rest, although it wasn't significantly higher. But this gives us some information that the effect of one exercise session lasts for an hour, maybe 2 hours, maybe beyond that short period of time. So this can help us think about like how would you want to incorporate something like an exercise session in your day or in your week. Maybe if you have a really important activity or a difficult thing coming up, you might want to exercise within a couple of hours before that because you might be able to have whatever psychological benefits come from that exercise still present during that activity. Again, though, we're just working off of aerobic data, so we don't have resistance training data for something like this. We're working on it. Maybe next time I come, I'll get to tell you about some resistance training data, but not at the moment. So this is really getting at those acute effects. So how low can we drop the depressed mood? How long can it last? Now the question becomes, what if someone starts an exercise training program, a resistance training program in particular, and continues to do this over time? How does that person end up feeling? And this is a meta-analysis. And so what this does is it takes every single study that has looked at a randomized controlled trial of either assigning people to resistance training or to some other control condition, maybe like health education, and then looked at depression as an outcome. And you don't have to get into the weeds of any of this stuff. But what we see is each study is one data point. And then we look across all the different studies to come up with overall, how big of an effect do we see if we take into account all of these different individual studies that were done. And that's down here at the bottom. So it shows that the average effect for starting a resistance training intervention compared to some control condition at the end of the intervention is a decrease in depressive symptoms of about 2/3 of a standard deviation, 0.66 standard deviations. Most of the time, a clinically relevant or like an important level of improvement would be like 1/3 of a standard deviation. So this is about twice that. And similar in a magnitude to the amount of benefit you'd see from therapy. So most therapies, on average, their benefits are about 0.7 standard deviations. So 0.66 resistance training seems to be in about that same area. The key point when we summarized all these different studies is that we looked at the different components of the studies that might be related to how big of an effect each study showed. And what we saw was that it didn't matter how strong people got. There was an improvement in depression regardless of how much stronger people got. When we think about designing an intervention, most of the time when we design a resistance training program, we're designing it to try to improve someone's strength, right? Like the idea of I'm going to go through this lifting program is so that you get stronger at the end. It turns out if what we're trying to get is people to become less depressed at the outcome, we don't necessarily have to focus so much on getting stronger. Maybe it's just the act of habitually doing this or getting into a routine that's more important for the outcome than the amount of strength people get. It also helps us to try to figure out, like, okay, well, what is causing people to feel less depressed after they exercise? You would think that, like, getting stronger is what's happening. Something involved in the physiology of getting stronger is going to be what's driving the response. But if the amount of strength gain isn't related to the amount of depression improvement, then all of that physiology that's part of the strength gains might not be the stuff that's driving the changes in depression. So it means that we still have more to figure out related to what it is that's really driving it. So to summarize this section, because there's a lot in here, there's sort of two pieces here. We see the acute effects of exercise and the chronic effects of exercise. And to summarize it all up, we see acute effects that we would expect to be moderate, maybe slightly larger than that, and that last a while, probably an hour or two, or maybe even more after each session. And we see that the chronic effects of resistance training in particular are as useful as the chronic effects of any of the therapies that we typically work with for something like depression. All right, so I talked a little bit about the idea of us trying to figure out what the mechanism is or what's leading people who do resistance training to become less depressed. And what we've been looking at in particular in my laboratory is cerebrovascular function. So we're looking at the way that the brain uses blood, and in particular uses blood to deliver glucose, which is what it uses for energy production, and how that happens in people who are depressed, and how resistance training might be able to improve deficits that might exist or abnormalities that might exist. So what we see up here is just brain scans of people who are depressed, about 200 older adult participants, and what the blue is showing is areas where there was less blood flow in adults who are depressed than in adults who are not depressed. And you'll notice that those brains are pretty blue. It's mostly blue and not that much brain showing up in those scans. And what this is showing us is that there are large areas in the brain where blood flow doesn't happen at the same level in people who are depressed. Thinking that if we can then improve the way that blood flow happens, in particular in different areas of the brain, that might also then be able to help with the depression. That might be part of what's happening here. This is a particularly interesting idea because the amount of lower blood flow that was seen was related to the clinical features of depression. So people who were more severely depressed had the least blood flow, and people who are less severely depressed were more similar to healthy controls, but had a smaller deficit. So since this sort of tracks with the amount of depression, if we were able to fix it, that might also then fix the depression. So one thing that we're looking at in my lab right now is this idea of using resistance exercise training to treat depressive symptoms and clinical depression by working through changes in cerebral blood flow, either thinking about the velocity or the speed at which blood flow happens, and also pulsatility. These are two ways to get into the weeds of cerebrovascular function. But essentially, it gives us information on how reactive the brain is to new stimuli. So it helps us understand, like, if we needed blood flow in a particular area, would the brain be able to quickly get it over there, or the vasculature, or would this not happen very quickly? Would we be slower to react? So that's what we're looking at. And the way that we're going about that is working with another colleague in the kinesiology department at Iowa State, whose main focus is cerebrovascular function. And we're looking at having people come through a 16-week resistance training program where they do twice a week of resistance exercise, going through that for 16 weeks, so 4 months, and looking at cerebrovascular function both at baseline and then halfway through at 8 weeks and then at the end of the 16 weeks. And then again at a 6-month time point to see how depression is changing as well as how these cerebrovascular function markers are changing. The guidelines for resistance training, again, are twice a week, and so that's what we're giving to folks. Our initial test here is just to sort of see, like, does this work? Will people do it? Is it feasible? Do people enjoy it? What don't they like about it? What do they like about it? And then we can use that to adapt going forward. And then see if we see any little beginnings of a signal for the depression or the cerebrovascular function outcomes. This study, we've got all of our 10 people in it and are at either 8 or 16 weeks for everybody. So this is ongoing, and we'll look to use these results to try to get a larger trial of 150 or 200 people to really test this out. But you got to start with, round 1 before you get to round 2. The plans are to think through resistance exercise compared to either aerobic exercise or combined aerobic and resistance exercise compared to an education control group. And we'll see how this goes. I'm excited. We haven't gotten, as the trial's ongoing, you don't look at the data. So I'm excited for the trial to be done so we can actually look at the results to figure out if this seems to be working or not and how we might be able to improve it going forward. So I wanted to end with a section on thinking about recommendations as well as sort of where the biggest opportunities for improvement are in this area for the future. So some of the stuff that we're thinking about and other people are thinking about to try to improve what we know about resistance training. What we see here is the guidelines, which are similar across all of the sort of guideline generating groups. So the World Health Organization, American College of Sports Medicine, the U.S. Physical Activity Guidelines, which are put out by the Department of Health and Human Services, All of them say that the guidelines for any adult above the age of 18 is to do at least 2 days a week of resistance exercise training using all major muscle groups. So all of the large muscle groups. And you can think about that as like the large muscle groups on the front of the body and on the back of the body, upper body and lower body. Typically, there's about 8 different exercises that get done to complete all of those, though certainly people can do more. And twice a week. This can be done via resistance bands, which are relatively popular, through just body weight exercises, which you see in the middle, or through using dumbbells or more traditional resistance exercise machines. One sort of recent advancement in the way that exercise equipment has developed over time is that there are dumbbells that you can get that are adjustable. And so you can have a dumbbell that goes from anywhere from 5 to 50 pounds. You just turn a dial and pick it up and it'll be whatever weight you were looking for. That can be really helpful for people who are not trying to necessarily build a home gym, but want to incorporate some resistance training into the stuff that they do. So these are the recommendations that we have: 2 days a week, most major muscle groups, or all major muscle groups if possible. What do we know about how we get this to actually happen? Well, one thing that we know is that people who enjoy their activity do it more often. And that might seem like a no-brainer. Like, yeah, the stuff I like to do, I keep doing, and the stuff I don't like to do, I don't keep doing. But when we think about exercise, there's often a disconnect between what we know makes sense and what we are trying to do. There has been an idea of no pain, no gain as part of the way that exercise should happen. And that's not really true, both in terms of we saw that no matter how intense exercise was, people felt better afterwards, but also in terms of thinking about what it is that someone's going to keep doing next week and the week after. If people engage in resistance training in a way that they enjoy, they're going to be much more likely to do it again next week or the week after that. This is also important as we think about what kinds of setups to do, because we know that the frequency with which someone exercises is related to the acute improvements. So you remember we saw that as soon as you exercise, people typically felt less depressed for some period of time afterwards. Well, if someone gets that benefit every day, then a large part of their waking day is affected positively by the last time that they exercised. This appears to be even potentially more powerful for things like blood pressure, where the acute effects of exercise on blood pressure, so exercise lowers your blood pressure right afterwards, this lasts for almost 24 hours. So if someone exercised every day, their baseline blood pressure would be lower because they're always affected by that last time that they had exercised. We can think about the same thing here for mental health. If you exercise daily, that would mean that your mental health was always sort of positively influenced by that last time you had exercised. So one thing that we, encourage from in general, twice a week is a good idea. If people want to do more than that, or do smaller things but more often, that might actually be useful for some of the acute benefits. And then one of the last things that we're always trying to figure out is, how does it work? Is it changes in brain blood flow patterns? Is it improvements in neurotransmitters, dopamine, serotonin, endocannabinoids, other things that might be sort of linked both to mental health and to exercise? Because if we can figure out how it's working, then we can design the best kind of programs to improve the how most effectively. And it could be that the social engagement is really important. We saw that a lot with Zoom over the pandemic, in that the more people were able to be engaged with others, the better their mental health. People who became more isolated expressed higher levels of loneliness. But if you could use something like exercise to stay connected, that was helpful. We can also think through what are the sort of physiological pieces that might be linking both, not just the social pieces, but the physiological pieces, exercise and mental health. Some of the things that myself and others are working on are trying to figure out how we get people to exercise again. How many of you guys have exercised at some point in your life? I hope it's everybody in some way, shape, or form. The question becomes, are you going to exercise tomorrow? And you don't have to do a show of hands to figure out if that was part of your plan or not. But the question becomes, how do we have people either start exercise or keep exercising? And so I think there are some moments when someone has been exercising and is sort of falling off the bandwagon that we might be able to intervene in a sort of critical time period to help people to maintain their exercise. Thinking through some of the stuff we know about that predicts whether or not people are going to keep exercising or not. So do people enjoy the activity? Can we get them to remember that enjoyment or remember positive experiences? Can we get people to make sure that their goals are such that they can continually meet them? And then there's a field of psychology that's focused on identity and how people view themselves. And if people view themselves as someone who exercises, their likelihood of exercising in the future far surpasses that of anyone else. So if you can sort of make that part of who you feel like you are, that can be really useful. And then the part that I always think about is the how. Like if we can figure out the how, that's going to be really helpful. So if we think about Gustav, if we go back and think about Gustav, as he's setting down that 692nd lift on that final day, what's happening to him physiologically? As he's setting that down, what's been going on in his body that could tell us how he's going to be feeling now and into the future? Are there pieces that we could look at in his bloodstream or through imaging methods in the brain that would tell us, yes, Gustav is going to continue to feel better for the next 4 hours? How can we sort of get that type of information from the types of studies that we're running right now so that we can learn how it's happening? Does Gustav feel better longer after that time he did 692 repetitions, that was his max, or the very first time when he did 104? Or is it the same because both of them were his maximum, and no matter what, as long as you're pushing yourself to the maximum, that's giving you the same sort of benefit? We don't know the answers to some of those things, but I think those will be really helpful as we sort of chart the path forward beyond Gustav showing us that if you keep doing it, it's helpful. Now, how do we wrap the brain and psychology into that information? So the final thing here, a reminder that the resistance exercise guidelines are twice a week, major muscle groups, and you can do this in just about any way that you want to. Many people accomplish this through body weight exercises, which means you need nothing other than your body, and we all have our bodies available. And so you can do push-ups, sit-ups, crunches, ab bikes, whatever. You can. There are programs that are easily accessible, or you can work with a trainer or someone else who will help you to define and figure out what you might want to do, or working out in groups like the woman in the middle picture there might be particularly helpful. I would assume that the woman in the third picture is looking at somebody, so she's probably also in some sort of social group, but I don't know for sure. So some of those other things that we know that are helpful might also be useful to think about as you guys might be thinking about, okay, do I want to do some resistance training, and how and where do I go about doing that? Thinking about the pieces that we know are helpful can be important in deciding that. So I want to make sure that I acknowledge the wonderful people who have been a part of the research that I do. The funding is obviously helpful to make this stuff happen from the Department of Health through the Health Resources and Service Administration, ISU, Kent Corporation, and then a number of people who I've worked with who have been really influential in helping me understand what it is that we're looking at and in driving what we do going forward. So Nathaniel Wade and Alison Phillips here at ISU, and then Matthew Herring, who's at the University of Limerick in Ireland, and Felipe Schuch are a number of people who have done a lot of the work that I just talked about. And then this is my lab group, and all of the stuff that happens with them, and much less so with me than with them. So thank you all for listening.
All right, I have the microphone, and so if you have a question, raise your hand. I'll come around. You have to be on the microphone so those people that are online can hear us as well. I want to ask one quick thing. That last one, the number 2 was highlighted in red, so that's, I know, exercise, but the number 5 is in red. What, did you talk about that?
No, so this was my not very clear attempt at indicating 2 days a week. So you could do it on the second day or the fifth day.
Oh, gotcha.
I should
Day
probably
2
put
and
like
5 of the
Monday
week.
and Thursday or something would be helpful.
Gotcha. Okay, thank you. Okay, first, and when I come around, please feel free to take your mask off so everybody can understand you.
Okay, you talk a lot about on land, but I exercise in the water
Great.
with weights. So it's basically the same thing, isn't it? Am I getting as much or better exercising resistance?
Yeah, good question. So is the land-based activity somehow better than water-based activities for resistance training? And the answer is probably no. So this sort of comes back to like, how is it working? And does that weight-bearing aspect of being on land that you don't really have in the same way in water really matter? And probably that's not part of how the mental health benefits happen. That might be how some of the bone health benefits happen. We know that people who are swimmers have worse bone health than people who are runners, even though they're doing the same amount of activity. So I would say that water-based activities are going to be at least as helpful. The other thing to think about is that some of the, if you're swimming, a nice thing about swimming is that you can't interact with anybody else in a way. You're sort of there on your own, and that can be helpful for people who take a time out from what they're thinking about.
And she does weightlifting probably in a group, but for those that are actually swimming laps, right.
Okay, you're thinking specifically about like resistance training in water? Yeah, yep. The other thing that's helpful about that is that it's often much better on your joints. And because of that, that might mean you're more likely to do it next week. So if this gets back at our will people continue it, even aside from the benefits, we know that that's important. And so, I'm all for it.
Well, I can do it for a lot longer,
Yeah, yep.
if I was on land.
Yeah, and which also will then be helpful, meaning you'll probably see better strength gains from it too.
Okay, the 16-week study that you do, I used to sign up for these things, and I haven't seen information on signing up, and I would like to. How do you do that? Or am I too old? Maybe I aged out.
So for this particular study, we only had 10 people, or we were only looking for 10 people, so we were able to fill that relatively quickly. But it was also in a population of people who were actively depressed, which made recruitment tricky. And for this study, it was 18 to 65. But there's certainly similar studies that are going on that have different age groups, either no cap at all or 75, 85, et cetera. But one way to get information about the studies that are going on is to, we try to promote that through the campus social media options as well as through some of the foundation. Like if you're part of, you may or may not be an Iowa State alum or affiliate, and often that's one way that a lot of people see the studies that are ongoing.
Can you tell us, do you have any good resources for how to get started with a weight training program?
That's a good question. So it depends. It'll depend on someone's situation. I feel like this is not a great answer. But someone who's living potentially in an assisted living or a community living environment, often there will be someone whose job it is to do wellness coordination, and that can be super helpful for them to be your first point of contact. Someone else who might be engaged with a healthcare organization often has either through their cardiac rehab program or through their general wellness programming has access to providing exercise-based information. You can, of course, always go to a gym to interface with a trainer who would give you one-on-one information, but not everyone wants to do that.
So but I do think that's worthy to point out that maybe if you've not done it before, go for a couple sessions maybe with a trainer to learn what to do, how to do it safely before you just started doing it at home.
Yeah, often the best way is to work with somebody who will be able to sort of check form and be like, ooh, maybe, shift your balance a little bit will be helpful to make sure to prevent injury. But there's also lots of things, especially the non weightlifting related ways of doing resistance training, like if you're doing body weight exercises. A lot of that can be done without oversight or training in the same way. So there are programs available online. If anyone wants to hear of a program, or if you want me to tell you about the 10-week program that we have going on, like I can share with you what those exercises are in case that'd be helpful for somebody.
Oh, I'm coming down 1 second.
So is it possible to just go online and get these exercises?
Yeah, yep. There will, is there a way for me to send information to like the group or something? Because then I might be able to send some.
Yep. You are welcome to send it to me.
Okay.
And then I can send it out to everybody who signed up for the program. So if you want the information and you came today and you weren't pre-registered, so your name wasn't on that list, you had to write it in, that means, well, I can probably still find your email. We should be okay. Yep. So yeah, go ahead and send it to me and I can share it out to those who have attended today.
Yeah, I can give a specific, set of exercises, as well as some links if you wanted to go look for more information.
That's great.
This might be a stupid question, but on the first slide with the baseline, and then it went up really high, and when he had his peaks and then he went down, would that just be like the body being fatigued, or can you explain that? Because it seems like a pattern.
Yeah, like why isn't this just always going up? Yeah, so there's lots of things that influence exercise performance. So this is really looking at like on each day, is he able to do the exact same thing he could do yesterday? And it turns out that our ability to produce the same thing is not perfect. And so maybe he didn't sleep as well the night before. Maybe he had just eaten. He tried to do it at the same time of morning every day. But that our best laid plans don't always work out. And so some of that variability could be from that. There's other parts of this that are the way that we get stronger isn't necessarily linear. So we first go through neurological adaptations in which our body is getting better at recruiting the muscle fibers that we already have. And so a lot of the strength gains that you see in those first 3 weeks, like his muscles haven't gotten any bigger or anything differently because that takes a little bit longer. But his brain, when he says, I want to push this above my head, is getting more effective at recruiting his own muscles to do that. And that's not perfectly increasing over time. So some of this gets at the sort of underlying neurophysiology of how this happens, which makes me super excited, but might not make you as excited. You're welcome.
Oh, we have a question up front here. 1 second. Tim, do we have any online questions? I don't think you heard me. Okay.
Not yet. I have a question about the research. So when you're trying to quantify how depressed a person is feeling, how do you do that? Do you ask them to rate how they're feeling on a scale of 1 to 10, or do you hook something up to their brain that gives you that information?
Yeah, good question. So how do we go about figuring out the level of depression somebody has? So there's a couple of ways that we go about doing it. One is just asking people, to rate on, these are the major symptoms of depression. How much have you felt this in the last 2 weeks? Because that's the time frame that we work with. But the other way, sort of the gold standard way, is to have a clinician interview the person. And so they go through a sort of semi-structured interview in which they ask the people about the various components of depression. And then the clinician rates, okay, this person, based upon their responses, is at a 3 out of 4 on this and at a 2 out of 5 on this. And that is the sort of the standard way to do it. There's not, because depression can happen in so many different ways, there's not a clear biomarker for us to draw someone's blood and say, oh, you've got a 12 depression, or to do a brain scan and say, this person's depression is X, which makes it tricky to do the research because it's, the the definition can be murky. But that's what's fun, because then you can try to figure it out.
Any other questions? Do you have one? Yeah.
For resistance training, is it true you should probably do it every other day, not every day? So the muscles have a chance to...
Yeah, so if you're using the exact same muscle groups, it can be helpful to give them a break in between. But it really depends on how intense each exercise is. So if you're doing something that is maybe 50% of as much as you could do, doing that every day isn't going to be as big of a problem as if you're doing something that's 80% of what you could do, and your muscles really need to recover from that before you go back at them again. Yeah.
Another question here.
Is there any place online that you can just get a list of this and do it on your own? I mean, do these exercises on your own?
So the U.S. Physical Activity Guidelines give sort of an overview, but it doesn't do a great job of giving a specific program. Mm-hmm. And I think what I'm reading into your question is that you might want these are the 8 exercises to do X number of times a week.
Yeah, like beginning exercises, more advanced exercises, and for people at a certain age.
What I'll try to find is sort of the ones that I think are the cleanest and easiest to access, and then I'll get those to Vicki so that she can get them out to everybody.
Okay, that'd be great. Thank you.
All right. We have time for one last question if anyone has one. Yes? All right.
We've got an expert. I'm going to take advantage.
Exactly.
So the whole brain blood flow thing, those slides were pretty interesting. Would there be any correlation with lower blood flow, increased depression? Do you know anything about the Alzheimer's component or dementia part? Can you address that at all?
Yeah, so people who have the beginning stages of dementia often develop depression. If you think about it, if you're no longer able to remember the things you used to remember, concentration and interacting with people gets much harder. That would influence people's mood. And so we often see a link between these, and there's sort of this vascular dementia is sort of blood flow mediated dementia. There's also the vascular depression hypothesis, which is sort of blood flow mediated depression. And there's this sort of constellation of the three that tends to happen together. And so when we looked at the slides that showed older adulthood and what some of the risk factors are, we would also, that cardiovascular disease links into also where dementia can start to show up. So there's certainly a nexus of the three together. I don't have great information on, if we treat the depression first, will that stave off the dementia, or how do we go about it? But one of the things that we do know is that the really only evidence-based preventative intervention for dementia and Alzheimer's disease is exercise. So we know that this is really an important place for us to think about when we're thinking about anything related to dementia and Alzheimer's disease and those aspects of aging.
Any last words to wrap up?
Oh, I saw one more question. I don't know if we're allowed.
You'll just have to repeat it.
I will.
If you do exercise and you have dementia, can that dementia be improved through exercise?
Yeah, good question. So can dementia be improved through exercise? And this is one area where there's not a clean consensus. So sometimes it looks like dementia can improve, but in other times it looks like it either stays the same or doesn't really do much of an improvement. I would say that the cleanest evidence for now is that it will halt or drastically slow the progression. But it's hard to say that it goes the other way at this point. I wish I could say yes, though.
Any last words you want to share?
No, thank you, everybody. I appreciate it.
All right. Well, thank you. Thank you so much, Dr. Meyer. Wow, great information. A great way to kick off our first in-person session in 2.5 years. Thank you so much. And know that we'll be having you back again another time. I want to remind everyone about our other upcoming programs, the next few that we have, and actually talking about dementia conversation. So this is more so having those talks with somebody who may be having some memory type related dementia issues. Tuesday, August 30th. Then Thursday, September 8th, we have Why Do My Hands Hurt? Common Causes of Pain in the Aging Hand. And then Thursday, September 29th, we have Easy Ways to Make Vegetables Taste Great. And I tell you, we did this program about 4 or 5 years ago. It was awesome, and we had so many people in attendance. It was wonderful. And there will be samples, just so you know. All of those programs are at 2 p.m. All of them are offered in person and virtually. So once again, thank you for joining us, everyone. Have a great day. Once again, thank you, Dr. Meyer.